everyone. From the Philippines, the inclusion of MMS to WHO's EML is a major win for us in our community, especially for pregnant women and their babies and globally. But more so, I think Clayton highlighted this already, more so amongst middle and low income countries. And it's really our hope that the celebration, this big win for us, this major win for us, will make MMS more available, accessible, and affordable. I can still remember the engagement and advocacy works that a number of organizations and network, and of course, including HMHB, have done so we can reach this and celebrate this particular milestone, significant milestone for our community, especially for pregnant women. So thank you to all the government and government organizations, private individuals and institutions for strongly supporting the inclusion of MMS to WHO's MML. While we do celebrate this major win globally, a more urgent and important question now, as it's already mentioned by for my topic, is that what would be the implications of this, major big win at the country level? And so today I'll be sharing with you some implications specifically for the Philippine context, which I've done, put together in consultation with key stakeholders in the country, like the National Nutrition Council and the Philippine Coalition of Advocates for Nutrition Security, or PhilCan. So please note that MMS has been introduced in the Philippines for years now, and you've seen in the earlier video a number of those organizations have been implementing MMS in the country. But it's also important to note that the implementation or distribution of MMS is only done in selected areas and not at a national scale. As an example, Vitamin Angels, with support from the National Nutrition Council, together with the local organization Diyos Mabulos Po Foundation, and the local government units, have implemented MMS distribution in one of the regions, particularly in Bicol region in the Philippines, reaching more than 10,000 pregnant women. But also for World Vision, as part of our COVID-19 emergency response, we have included MMS as part of the relief food packs in partnership with the Department of Health. From these experiences, examples, and many other MMS distribution or implementation, it is important to note that there was no report of negative feedback with respect to the use of MMS. It even has anecdotal suggestion that MMS improve the birth outcomes. And overall, we have noted that the key challenges are really around MMS availability and affordability. So at the moment, to date, MMS is not yet included in the Philippine National Drug Formulary, or the EML equivalent for the Philippine context. And for MMS to be included in EML in the Philippines, a local study is a prerequisite. And this is a major implication at the country level, at least for the Philippine context. But nonetheless, it's really also important to note that in the Department of Health Memorandum 2020-0092, also known as the Interim Nutritional Guidelines for Women of Reproductive Age, MMS is recommended particularly for undernourished pregnant women or in areas where undernutrition is prevalent. The department's memorandum, this particular memorandum, also says that pregnant women provided with MMS will no longer be provided by IFA. And also important to note that the shift to MMS is already included in the draft revised micronutrient supplementation manual. And as I mentioned, to support the policy review on the transition, which is a key implication in the country, from IFA to MMS, various organizations are currently conducting local implementation researches, like the Maternal Nutrition Pilot Project by UNICEF, in partnership with Nutrition Center of the Philippines. The project includes MMS implementation research, which hopefully will document the acceptability and compliance with MMS use and its effects on maternal nutritional status, Another ongoing project is the Joining Forces for Last Mile Nutrition. This is a collaboration of Royal DSM, Sight and Life, and World Vision, which aims to provide technical support towards the amendment of national policy on micronutrient supplementation, which will provide specific recommendations on availability and access to MMS, including review of supply chain management. So the outcomes of these studies and other related MMS implementation researches in the country are vital to support the Department of Health as they present to the Philippine Congress the shift from IFA to MMS and ultimately inclusion of EMS in the Philippine National Drug Formulary, or the Philippine EML. I hope my presentation helps you as you reflect and also address key implications in your own context, in your own country, and the challenges that we are facing.